What an inspirational panel. I'm glad that I was called in to moderate. We're going to have about half an hour for questions and answers. And I just want to share a reflection after hearing such wonderful presentations by Suruchi, Lori, and Malika. And in the last 30 years, the progress of public health or violence prevention, just the whole field of violence prevention, is incredible, no? And it is very evident now in the field of media and information technology and communications, that the role that it's playing. I see common threads across the three talks, and these are common threads that have a strong grounding in public health. The first common thread that I see is the ecological framework. And Suruchi emphasized the importance of working at the individual, but also at the family and at the community level. And this embedded approach that characterizes the public health framework is very important. I also see a very clear call for a life course approach to violence prevention. And within all of these presentations, these common themes are also taking the importance of evidence and measurement as a core value for these interventions. Another common thread that I see in all of these presentations is a multi-sector approach, an integrated approach that takes into consideration several different players, always. And that is the only way that public health has moved forward, for example, in the fight against polio or smallpox or other infectious diseases, is precisely these core components that I just described, and a critical one that we see clearly in the India, in the Daruchi, what's it called? The Indian Bel Bajao, is social mobilization. The mobilization of society for the well-being of populations is something that seems to be implicit in the messages that our panelists are sharing with us. So let me emphasize these four things: an ecological framework, an evidence base, a multi-sectoral comprehensive approach, and social mobilization around the underlying causes and the social determinants of this global pandemic disease that we have heard of. So I would like to invite you, please, to raise your placards if you're interested in making a comment or have a question. We have 25 minutes for your interaction. There's microphones on both sides of the room, please. If you may introduce yourself.
Sure.
Tell us where you're from.
My name's Caitlin Thistle. I'm from USAID. My question is for Malika. I actually had the privilege of meeting Meghana Rao from your organization. And it was interesting. She was at a child marriage and media event. And it was interesting. She talked about your work in Jharkhand and Bihar, and doing implementation science to end and interventions to end early marriage. And it seems very different from the intervention that you were talking about today. So I just wanted to know a little bit more about Breakthrough and your strategy and your investments and what is the breadth of your work.
We're a little bit like that elephant with a blind foot. Is that working now? Okay, so we're a little bit like an elephant. You know, it depends on whether you grab the trunk or the tail or the leg. So in terms of which aspect of Breakthrough you're going to hear about. So the work that Meghna described at this conference meeting on child and early marriage that happened in DC actually just a few weeks ago, really the methodology has evolved from the work that we did in Bel Bajao. And you know, like I said, I didn't get into sort of laying out our approach in the more scientific, academic way. I can't imagine that Meghna did too much of that either. But anyway, so here's how we go about constructing a program and then what we end up sort of how we end up implementing. And I'll walk through our early marriage work so that you can see what's happening currently. So in Bihar and Jharkhand, as you might know, early and child marriage is a big problem. We say early marriage instead of child marriage because, you know, a 16-year-old and an 11-year-old are very different in their sort of ages of development and the needs that they have. And we just think it's really important to recognize sort of the different stages of adolescence and the needs of young girls and older girls. So we first did a formative research process where we really tried to understand why, despite having the laws on early marriage for all of these years, we've had such trouble addressing the issue. And so in the process of that formative research, what we discovered was that really the people who were making the decisions in the families were the fathers, and there was very little by way of intervention that spoke to the relationship between fathers and daughters. We also discovered that in that decision-making process, it's a complex set of factors that go into that decision-making. It isn't simply, oh, we want to marry you off early because you're a dowry burden, right? There's also all of the ways in which girls are exposed to violence. And so there's this whole idea that if you marry off your daughter early, you're actually creating more safety and protection for her, and you're making sure that she then has the pathways to, you know, a married life without ending up being raped or whatever it is along the way. So there's a care that's part of that decision making. And then of course there's sort of the social pressure, like if you don't get your daughter married early, then you're bucking the trend, and that sort of adds up with another set of issues. The other thing that we discovered was that in terms of girls being able to go to school, the passage between home and school was really fraught with danger. So that, you know, even sort of the ability of, if you're not going to get your girl married early and you can't send her to school because something's going to happen to her along the way, then she's either working in the fields, so she's still doing something that you don't necessarily want her to be doing, but you've got to kind of address these things together. You can't just have like a compartmentalized way of intervening in these situations. So what we decided to do as a result of that, and then, you know, we set up the baseline and all of that good stuff, was that we identified school principals as a critical source of intervention. We identified heads of local panchayats as critical points of intervention. We identified fathers, so how do we engage with them through farmers associations? How do we engage with them through kind of male associations that you wouldn't necessarily be thinking about as a location for how you do your early marriage work? And of course, we always work directly with young people. So all of that has come together. There's a mass media strategy. So there's television, radio, print, wall hanging, wall paintings, you know, all of sort of the integrated communications piece. There's also then the training and the capacity building that happens with these groups of people. There's community-based plays that happen that kind of demonstrate the rights of the girl and sort of her making different decisions. So it's a whole bunch of different things. And then we kind of weave in support of young people in cities by creating social media campaigns like the Selfies for School campaign, where we got Vodafone, which is a phone, whatever, cell company, to actually support girls' education based on the number of selfies that came in. So you basically took, the campaign was called Selfies for School, but we were able then to sort of connect what feels like a distant thing that's happening out there in some rural area to young people around the country, and it ended up becoming a really important intervention. So that's kind of a snapshot of the way in which we think about all of the different elements that go into the work. Now what's happening is that we're scaling up in partnership with UNICEF, and we're training a whole bunch of their other partners in India on the methodology that we've adopted. There's also an RCT underway, but don't ask me any questions about the RCT. I'll have to ask Lori to help me even interpret all of the language, but we're just at the midline, and that's, you know, also telling us lots of information along the way. I'm also learning a lot about RCTs and both the potential and constraints of what is possible with RCTs, and, you know, I think the biggest challenge that we have is because we have all of these control sites that when something happens and we need to intervene, we're like, sorry, we can't come and work there. And it just feels, it's like my heart is breaking because that's just not the way one operates from a human rights perspective. But anyway, I don't know if that was helpful for you, but that really built on the Bell Bajao campaign methodology.
Thank you very much. We have one question here, then Michelle, then Lee.
Hi, my name is Naira Kalra, and I'm a doctoral student at the Johns Hopkins Bloomberg School of Public Health, and I work in GBV research. And I'm just taking this opportunity to actually just get Suruchi and Malika to talk a little bit more about soap operas, because I'm fascinated by how they can be used and how they can be effectively used. Particularly because I find a lot of interventions that we've talked about come from village and community settings, and we're not necessarily being able to translate them to urban settings with less connectedness, where you don't have access to people in the same sense. So I think I had two questions related to that. One, how do you add an individual component to soap operas to make them more ecological? And B, how do you translate soap operas to reach men, particularly ones who would just quickly say, this is outside my scope of, I'm not someone who can engage with my neighbor, or I'm not someone who will go and ring a bell, or I'm not someone this applies to. How do you reach the not so low-hanging fruit? So, two questions there. Thank you.
Mine. The field of study is known as entertainment education. It started in Mexico many years ago with Miguel Sabido, creating soap operas to change people's behavior. The very first ones, called Simplemente Maria, actually resulted in women going out to buy Singer sewing machines, because the storyline was of a young disenfranchised woman who bought a Singer sewing machine, and the sales shot through the roof. The story also had a marriage, and this was a fictional marriage, and people in Mexico City, apparently there was a traffic jam that lasted hours because people showed up to attend this fictional wedding. So the way these mechanisms work, and it is more than just soap operas, because I'm talking 1960s, and now we're in 2015. It's a whole field. It's a way of looking at the world from a communication perspective, where we know, when you entertain people, they learn best, right? We have used it for, it's really an academic field of study, regardless of what others say. There's books and numerous articles. My own work on it was, somebody asked about Tanzania, was about 20 years ago in Tanzania on an HIV/AIDS soap opera. Currently, I'm working on one in Mozambique, which is absolutely fabulous, does deal with child protection issues, including, for example, a whole storyline about sexual abuse in schools. And the storyline is about a young girl who gets pregnant because she's sexually abused by a school teacher. And what it does is it shows you various ways that you look at this person, or you hear this person, they come into your life week after week, they're real to you. They are like your friend. And they are, as they transition through their life, you begin to feel, if they can do it, I can do this. And that's how it operates in terms of role modeling, in terms of social cognitive theory, on how people learn from their role models. And there is indeed ways to role model appropriate male behaviors, right? Men don't want to talk about using condoms, but it is something that has been proven in the health sector over and over again. And in Mozambique, for example, it's really a matter of, so if you do hear about a case of sexual abuse, what do you do? What are the actions that you can take, and what are the various ways? And the soap opera shows you how to do those behaviors. So it's really a matter of creating those role models, if you will, and then following them through time. And then really, I think also what Malika was talking about, this notion of downstream and upstream approaches, or bottom-up and top-down approaches, I think is critical. You can't just expect to put something on the airways and have a major change happen. So it really has to be linked together with community-based interventions. Does that?
Thank you very much, Suruchi. I have Michelle, then Elizabeth, then my friend there on the microphone, and then Richard and Evelyn. Please, Michelle.
Thank you very much. And first of all, Malika, thank you so much for sharing your very heartfelt story. It really moved me, and it was something I actually really needed to hear, so I'm very appreciative. And my question is to you, although I have a second question, but I don't want to be abusive of my time. It's because we know that so many of the men that you're working with who are interrupters are actually also perpetrators. And we have very good data from the Partners for Prevention study and others about the levels of perpetration in Southeast Asia in particular. And I'm just interested in if you deal with that issue at all when you're dealing with the Interrupters campaign. Like, do you talk to, or is it just kind of in denial and today's a new day and now you're going to be a helpful person without necessarily acknowledging your past? And the second question I have is actually to Suricha, and I have to say, I love a soap opera as much as the next person, and I love Shuga, for example, which is another really terrific one. But I will have to say that we actually haven't really, I guess my question is about how do you measure the impact of a soap opera really? And I would have to say that if you look at the HIV epidemic in sub-Saharan Africa, we've had massive investments, especially if you consider the cost of a soap opera relative to actual, putting that condom on instead of saying, wow, that's so great. Thank you.
So we don't really think about our work in the context of interrupter programs. Like, that's just not the orientation at all. I mean, we really orient from a human rights perspective and a culture change perspective. So the ad, the Bell Bajao ad, is a way in which we model a social disruption of several norms by, challenging the whole notion of private, what's the role of men, how do men hold men accountable, and all of those pieces. But then that's embedded in a much larger framework of how one looks at gender-based discrimination and violence. And so the capacity building, the training programs, the leadership development work is all about how do you address gender from a human rights perspective, and then how do you deal with your own stuff in the context of that, and then how do you show up as an advocate in your own community. And it takes different forms, obviously, depending on whether you're talking to a cop, or whether you're working with the prosecutors, or whether you're working with young people, or whether you're working with, the panchayat head. I mean, it's not all the same because the places that they intervene are different, but the work that we do with men and boys is not about being interrupters. It's about really stepping up to be leaders and advocating for not just gender equality, but definitely gender equality in the paradigm of this new world that we want to build. So having said all of that, the other part of the story is that the ways in which violence plays itself out, particularly vis-a-vis children, is that perpetrators are not always only men. I mean, so one is, and that's why I said what I did when I was up there, is that we actually live in a culture of violence, and that it's not even like those men out there. I think all of us, I mean, and I include myself and all of us in this room, have grown, we're all, we may not act in, we may not be expressing our violence in overt acts of violence, but certainly if we have conversations about our workplace culture, or how we treat one another, or how our bosses treat us, I mean, God knows, I think I have enough conversations just even, with my own colleagues or even in my own role as a founder and a president, I think every single one of us needs to be kind of looking at how the shadow places, if you will, play themselves out and how we all show up. So I don't know if that's really answering your question, but yeah, I mean, for me, the interrupter programs are really just sort of a tiny way into a thread that's about broader culture change.
Thank you so much for your question. I was hoping somebody would ask me about measurement. I think soap operas are a bit of a misnomer. That sounds really exciting and sexy, so we use the term, but really what we're doing is communication campaigns or strategic communication or using communication approaches. And soap operas is a small part of that. I think that's a clarification I should just go ahead and make. In terms of measurement, we measure the effectiveness of our communication campaigns just like we measure the effectiveness of any full coverage program. So they're no different, really, than full coverage programs. I've been fortunate enough to be involved in a field experiment where it was a radio-based program in Tanzania, where one area of the country didn't get the radio broadcast, the other areas of the country did get the radio broadcast. I'd be happy to share the citation for the published work that came out of that. This is years ago. We do our standard baseline, midline follow-up studies. We've done case control designs. So really, the measurement isn't all that different than measurement is across other things. I think the ways in which it is different is perhaps that we prefer to use more mixed methods approaches, more participatory approaches, really. Finally, I believe you asked about cost and cost effectiveness. And you'd be interested to know there is research that shows that creating a soap opera is actually more cost effective than any other health promotion or health education intervention that you can do. And I'm glad you brought up South Africa in particular, because the study was done in South Africa for a project called Soul City. The issue that they looked at was violence against women. There is Social Science and Medicine has an article that shows that the soap opera, in that case they do call it soap opera, or edutainment program, was directly responsible in some ways, in passing legislation about violence against women in South Africa. So there's lots of good data out there indeed.
There is more question just connected to that soap opera. Very, very small. Is the bad taxi driver?
Huh?
Oh, is the story of that horrible taxi driver
It is the story of the horrible taxi
that
driver.
ultimately dies?
Yes.
And was it, how long was
He's
it
a truck
effective?
driver.
Yeah.
But small difference.
How long was it effective?
So
What
we
did you-
studied this for 7
is
years.
connected to this. 7 years.
7 years.
Let me take two questions from that side, please. The person who is standing up and Elizabeth will hear both questions. We'll answer them, and then we'll take two more questions from Richard and Evelyn before we close the panel. Please, ma'am.
Hi, my name is Afifa Abdurrahman, and I'm a gender advisor working in the Office of Population and Reproductive Health. Hi, Saruchi. So my question is, I'm a great proponent of entertainment education and soap operas, whatever we want to call them. But I wanted to ask each of you this issue of creating small, doable, actionable steps for audiences, and how relevant is that to encouraging people, regular people, not those who work in violence prevention or those who, that have anything to do with this field, but people who are living their daily lives and have 1,000,001 things to be responsible for, to keep their eyes on, and et cetera, et cetera. And I often think that, and often I wanted to ask your opinion about programs that include this piece of small actionable steps like ring the bell, go, to get men and others to be involved, to make things more digestible for them so that it's not so overwhelming, this issue of how do I prevent violence, or how do I respond, or how do I contribute? How do you think this has impacted on entertainment education programs or other communication programs? Thank you.
Okay, let me take one more question, and you can answer both at the same time. Elizabeth, please.
It has. Hi, Elizabeth Ward, Violence Prevention Alliance, Jamaica. Two things I wanted to ask you to comment on. One was the unintended consequences of a communication campaign, and how do you measure for it, and how do you minimize that effect? But Laurie, in particular, I wanted to ask you, how do we frame this conference and the content of this conference to make it into the news? The way you say you set the agenda, shape the debate, and reach a decision makers. And if you could help us with that process, because often we don't get to it.
Good heavens. Well, let me combine my thoughts on the two questions. And I'm not an expert in entertainment for education. What I'm an expert in is media advocacy, where the idea is that we want to use the media not to deliver a message to a consumer, but to help people raise their voices for policy change. It's a fundamentally different shift. It doesn't mean that the soap opera model doesn't work in certain situations, but if it's broad-scale social change we want, and remember my perspective is from the U.S., I want to see policy change at the local, state, and federal level, generally speaking. Now, the conversation this morning was interesting about whether policy is distant from a social norm and whether it's going to work and whether you have to close some of those gaps. So I think there's lots of variables here to consider. But what I'm interested in is using media to help people raise their voices. So what interests me about the Bell campaign is not so much the moving commercial, even though it was moving and inspiring. What I'm more interested in is the part we don't see, which is the training, the leadership development, the structural changes that people are making in the way they behave together. And so I think bridging those things can be extremely important because it's so easy to get distracted by seductive media. These days, social media is the shiny new object in the room, and we think, oh, if we could just get the right message to the right person in the right way at the right time, then what? And will it be enough? And is it really about social change? So that's the question I have. And then about framing this conference to get news attention. When anybody comes to us and says, can you help us get news attention, the answer is, why? Why do you want news attention? And you must work backwards from a strategy that has a specific goal, and it can't be a general goal. So you have to marry these things and integrate them together. So we could start from there, and then we can figure out whether getting news attention solves the problem in the way that you want to solve it. And I hope I didn't mischaracterize the campaign.
So I want to share one of our campaigns in the United States. One of the things that we're working on here is the whole question of campus-based sexual assault, and our approach is actually to work with fraternity men in looking at the norms of masculinity and the gender norms that lead to that kind of situation on college campuses, as well as looking at the norms around femininity, and also in conversation, not yet training with yet, but in conversation with sorority women, because, this dance happens on both sides. So in terms of your question about actionable steps, I think that it's really important to always provide some examples of what disruption might look like. I mean, I use the word disruption because I feel that the act of ringing your neighbor's bell if you hear him beating his wife is not very simple. It's actually an incredibly brave and difficult thing to do. There's nothing simple about it. And, you know, whenever we've had our conversation with folks in the US who love the campaign, you know, the response is, shit, if I do that, I'm going to get shot. Right? And so there's a whole other culture of violence. There's a whole other culture of there's a whole other gun culture that's at play in this country that makes the efficacy of something like the Ring the Bell campaign not so possible, whereas in India, you know, so I just want to put that mix on the table. So in some of the stuff that we're doing with the, you know, with the fraternity men, we've actually been creating animations. So it's a whole different way in. And so we have these animations that really are about peers telling peers, dude, that's not okay. That's too far. Really, and then again, it's an act of disruption, because what we found is that the hardest place to intervene is with your peer group. And that's also usually the most effective place of intervention, right? So it's a both and situation. So how do you create acts that are disruptive and also yet not set the bar so high that no one's going to do it? So just wanted to share some of those insights, yeah.
Thank you. And we're going to take the last couple of questions. We're going to have 5 more minutes of extra time, so we have 8 minutes. Please be brief. Richard and then Evelyn. And I think the lady back there as well. If you can, the three of you, give us your questions, and then we'll do the same. Thank you.
I'm going to try to be brief and try to be coherent, but I'm jet lagged, so if I'm not, just call me out. In our small group this afternoon during lunch hour, we discussed this incident in the United States using the phone and how it has viraled around the world of capturing an event. But as one of your presentations shown, you're capturing a small piece and not necessarily the context or the picture. We don't have the whole picture. So there is this extraordinary change in our world with social media and the access that we all have to seeing things we would have normally not seen before. Editors are no longer selecting, a series of men are no longer selecting what is good for us to know. We can choose ourselves through a whole variety of new channels, and the medium has become the message. I guess my question to you is, where do you see our ability to mine this data, this new incredible amount of information that we really still are not mining to be able to use, number one, to understand convergence of some of these community things into a global. We're going global. These issues are now becoming global. They're no longer just related to one community, but we're able to, around the world, question ourselves and our view around these issues. Where do you see us moving with this evaluation, with this monitoring, using some of this new data, or its impact on how we can reprogram, no longer just from a small from a small perspective, but from a much larger, you know, the global village really has arrived. And where does that lead us next? And what are some of the things you see in a crystal ball, including you, Arturo?
Thank you very much.
Thank you very much. My name is Evelyn Tomaszewski, and I'm a member of the forum. I want to start by saying I was looking at the information you had about behavior change, and this is the second time I've seen Ring the Bell, and I saw it many years ago and realized that I had never done that. And I live in a culture, a community that makes a presumption that we are all prepared and ready to engage, and we understand the importance of addressing violence. So actually the following week I honked my horn, which wasn't quite as brave, but it was something that helped me realize my own behavior change, which leads to my question of, with behavior change occurs relapse. And I think about laws around like the Convention on the Rights of Children, the Violence Against Women Act, the American Disabilities Act here in the United States, and how we have laws, we have regulation, but they are framed, this policy change is often framed as a burden, an economic burden, or an infringement on parental rights or individual rights. And so how do we address this relapse? How do we sustain behavior change so that even when we have laws or regulations or conventions, should we enforce them, that they really become part of our fabric?
Thank you. And our last question of the panel, ma'am.
Yes. Hi, I'm Betty Lee Davis, and I am currently an independent practitioner, clinical social worker, but I've had many years of experience in other settings, including a number of years at the Johns Hopkins Hospital on individual adult and inpatient child. And most recently, I've been doing community-based work with individual and family, child and adolescent, and also providing grief support to women who've lost children to violence in the city of Philadelphia. And I just wanted to make a response. I didn't really have a question for Malika, to say I appreciated the end of your presentation, and I could identify with that as a result of the past 8 years working increasingly in situations and with violence and trauma. And I wanted to bring to the attention of those attending here a documentary where I'm on the advisory board, but it's produced by Vic Comfer and Rodney Wittenberg, professional caregivers, their passion, their pain. For anyone who might like to see that, you can Google it. Vic Comfer is also going around the country doing screenings. And on the documentary, included in the documentary, interviews with Sandra Bloom and Charles Ramsey, among many other professional caregivers in hospice and child welfare. So it is a response to what you shared with the group.
Thank you very much, and I'll open it to the panel. Let me make a brief comment, Richard, regarding your question. In this book that I was mentioning, Richard Daniel Radenberg, presented us on our meeting on communications technology and violence prevention, the use of big data for suicide prevention having very important opportunities. The study of current online behavior can happen actually because the massive data that is being generated by user online behavior. And Daniel suggested that this could be used to identify people with at risk for suicide, and also effective intervention approaches. The patterns of online social behavior, what people post, the words that they use, the consumption patterns of social media are all important aspects that research could tap into in order to understand and prevent suicidal behavior. That is one example. And another example that is very recent, the Being 13 experiment that was done and followed the social habits, the social media habits of randomly selected teenagers in several states of the Union of the United States, has amazing results to show how teens are totally submerged in a culture of social media that's even more important than real relationships, what's happening with them and their phones. And this is a huge, I think it was made by CNN or a special report that had some incredible results of using social media and online behaviors in order to identify at-risk youth for certain rape, for example, or other things. Let me open it up to the panel, please.
I have a couple quick thoughts on both of your questions. On the first one on big data, we look at big data not in the context of violence prevention. We look at it in the context of food and alcohol, mostly food. And the biggest users right now of big data are companies that are trying to sell us something. And so it can be fraught for that reason. It can also be fraught because of privacy, even though there are really interesting things perhaps that can be done by examining it. We catalog what they do in a website called digitalads.org. So we're looking at it from the perspective of how companies are targeting kids, and there's a database there, and if you were curious about it, you could see what techniques would be available, and there are different ways to use them than the way Coke and Pepsi and McDonald's do, but nonetheless, that's where most of the attention is right now, at least from my perspective. When you were talking about using our cameras, of course, what came to mind for me was Black Lives Matter, and the fact that in this country we have been able to document brutality that has gone on for a long time, but now is part of the public conversation in a way that it hasn't been, and in a way that social media, in its role as witness, has allowed people to enter a conversation that they didn't have control over before. And I think that's very promising and interesting. And even, we're sitting in Pew right now, the Pew Institute did a study comparing some of the social media, not on Black Lives Matter in particular, but on Ferguson, and looked at the difference between Instagram and Twitter. And what was fascinating to me after studying news for decades is that what they found mapped onto exactly what we find in news analysis. In Twitter, I was going to say the punchline of the report. My violence friends don't like me to say that. The conclusion of the report was that in Twitter, it was like episodic news. It was about the event, it was about the portrait, it was about what's happening now. On Instagram, on the other hand, perhaps because it was a photograph that was being commented on, there was a different conversation present. It was about root causes, it was about structures, it was about systems, it was about the interaction with individuals and systems. And I think that's promising, and I think that most of the research right now shows that the mainstream legacy media, as people are calling them now, are still setting the agenda. But there are openings, and we are in a moment where that can change. And I don't want to get rosy-eyed about it, because I think that there's still big obstacles. But you no longer need to have the resources to own a printing press to have a voice. But just taking a picture with your phone doesn't also get you there either. So, we're still in this kind of moment. Elizabeth, your question about the Americans with Disabilities Act and behavior change. Well, what that made me think of, I mean, what you said was that, now it's looked at as a burden. And I don't think there's any perfect policy, of course, but part of the reason that policy is so important to me as a public health person is because it helps us establish the structures that are going to, if we do it right, lead to better health for whole populations, not just individuals. And it reminded me that our first office in Berkeley, California, there was a plaque in the sidewalk that I walked over for years before I stopped to read it. And when I did stop to read it, I realized it was commemorating the first curb cut in the United States of America from 1978 that allowed people in wheelchairs to leave their homes independently and go where they wanted to. And the ADA brought us, transportation, public transportation. So sure, some people see it as a burden, too bad. And there are policies that aren't always going to be perfect. We do the best we can in tough political situations, but it is incumbent upon us to figure out how to make our environment safe for everybody and structured in a way that everybody can achieve health. And I think that's one way to do it.
Okay. Thank you very much. I would call on you to give our panelists a big round of applause, please.